Hello everyone and welcome back to the channel. My name is Kitty and I'm an academic surgical trainee in the UK, having gotten my top choice job this year after the core surgical training or CST interview season last year. In this video we'll be focusing on the CST interviews themselves, how they're formatted and how you can prepare for them and maximise your points. I've previously released a video covering the CST application process and timelines as well as the portfolio scoring criteria, so do check that out if you haven't already, but otherwise let's dive right into it. So firstly, let's talk about the format of the CST interview. Up until 2020, the CST interview used to be face-to-face and it consisted of 3 parts: a portfolio and CV station, a clinical station and a leadership and management station. Since the pandemic, however, interviews have now moved away to an online format and now only consists of the clinical as well as the management stations, since the portfolio scoring is now entirely reliant on the oral self-assessment score. Each of these 2 stations will last 10 minutes, making the total interview 20 minutes in length. You'll usually have 2 consultant interviewers on the panel for all of the 20 minutes, as well as additional admin staff who will time you and sort of manage the logistics of the interview on the day. In the 2022 application round, the maximum marks achievable in the interview was 144, with 72 marks each given to the clinical station and the management station. We'll of course go into the details of how these marks are broken down in each of the stations shortly. In terms of the preparation for the interview, I think I started preparing for my interview about a month in advance. In my case, I actually felt like I didn't have to prepare that intensely, partly because I had just done my ACF interview about a month or so before, so I was sort of already in the zone for interviews, and also because I've passed my MRCS Part A at this point, so revision for the exams actually really helped with my clinical knowledge that was required for the interview. If you haven't done a lot of surgery close to the time of interviews, I would probably start a little bit earlier to give yourself time to do some reading around some emergency surgical clinical scenarios. I will also go into such a specific resources that I use to prepare for each of the stations, but generally a really useful book for everyone is the Core Surgery Interview book by Alexander Logan and Andrew Fisher, and although it's slightly sort of outdated now after changes to the interview made in 2020, it's still a very useful book to cover what is expected of you in the interview and the management stations with lots and lots of example questions, so I would really highly recommend it. There's of course plenty of other online courses as well with example stations, but what I found is that they actually overlap quite a lot, so I wouldn't go crazy with such a spending money here. The ISC Medical Interviews book is also generally a useful resource for interview skills in general, but just remember that the bulk of the questions in that book are kind of focused on portfolio and CV, which is less relevant to the CST interviews nowadays. Close to the time of interview season, luckily my trust had organised some free mock interviews led by surgical registrars and consultants, and it was really useful to simulate what the interview would be like, so I would definitely recommend trying to arrange some sort of mock interview, but try to avoid paying for one if possible. You can try to approach some surgical registrars and consultants in your trust and ask if they could give you some interview practice, essentially for 10 or 20 minutes. Generally people are really happy to help, and you might find that there are actually plenty of consultants in your trust of experience in interviewing candidates themselves, so really worth asking around. Okay, so in terms of the 10-minute clinical station, you will have 2 successive 5-minute clinical scenarios on which the questions are based. Scenarios will usually revolve around an acutely unwell patient on the ward or a trauma scenario. General surgery or orthopedic themed scenarios are usually the most common ones to come up, but just remember that scenarios from any surgical specialty can be used as well. Some common scenarios might be attending a trauma call, post-operative pyrexia is quite common, sepsis, abdominal or loin pain, as well as other emergencies like epistaxis, paraphimosis, upper GI bleeds, and acute limb ischemia. Generally, you'll be given the scenario and then you'll be asked what would you do initially. This usually means that you have to go through an ABCDE approach, so you really need to know this well off the top of your head and practice it to the point that you can say it out loud within a couple minutes without really having to think too much about it. Depending on the scenario, you may also need to incorporate ATLS principles for trauma cases or CRISP for unwell surgical patients. And you need to say these acronyms out loud as well to show that you are actively thinking about it. It's really worth having a read of the handbooks for each of these courses as revision prior to the interview, even if you haven't actually attended them so far. Don't forget to escalate appropriately to your seniors as well, as it is likely that in all of these scenarios the patients will be unwell enough to actually require senior input. You may then be asked some follow-up questions specific to the condition or further management steps. So for example, the stages of hemorrhagic shock in a bleeding patient, or the definition of an AKI, or risk for certain post-op complications like anastomotic leaks. Remember that you will be assessed at an F2 level, so there won't be huge amounts of surgical knowledge that is required. The key is demonstrating that you can be a safe core surgical trainee. In terms of scoring, each clinical scenario will be scored separately on 3 criteria, so clinical skills and knowledge, judgment under pressure and prioritization, and communication. Each of these criteria are scored out of 6 from each of the 2 panelists, so you get a maximum of 12 marks for each domain. In preparation for the interview, in addition to reading the CRISP and ATLS handbooks, which are both available online somewhere, you'll need to be well versed in common surgical presentations and emergencies. As I mentioned earlier, having done the MRCS Part A exam prior to my interview was actually a huge help for my surgical knowledge, but most of the time I felt that the knowledge required is not that much in depth actually, so I wouldn't worry either if you haven't done the exam. I would definitely read up on some common surgical presentations and their acute management. The core surgery interview book is really good in this sense because it covers most of the common topics that you might be expected to be asked about in the interview, and it gives you an idea of the level of questions and answers that you would be expected to give in the interview to score top marks. There are also plenty of other resources and question banks out there on a quick Google search, like MediBuddy's got some, coresurgicalinterview.com, and surgicalinterviews.co.uk. I personally didn't pay for any of these resources, so take what I'm saying with a pinch of salt. But they are available if you feel that your knowledge base is a bit shaky, or perhaps you haven't done a surgical job in foundation years or in recent times and you just want to freshen up your knowledge. Moving on to the leadership and management station, this is again split into 2 parts, a pre-prepared presentation and follow-up questions, as well as a management scenario. About 2 weeks prior to the interview, you will be sent the topic of presentation, and surprise, surprise, this is usually something to do with examples of your leadership skills and management skills. You need to give a 3-minute presentation without any PowerPoint or visual aids and without any notes, and then answer some questions from the interviewers for another 2 minutes. For the presentation itself, 3 minutes is a really short time, so I would limit your leadership example to just 1 or 2 maximum and be concise about the skills you gained and how this is applicable to a core surgical trainee, ensuring to hit some key buzzwords about leadership and management, such as, having a vision and carrying it through, being resourceful, being organized, and being a good team player. The questions that usually follow are a mix of management type questions like what makes a good leader, is there a time that you experienced bad leadership, as well as questions relating to your portfolio and CV and why you use particular examples in your presentation. For this, I would highly recommend reading the Royal College of Surgeons Surgical Leadership Guide to Best Practice document. It is only a very short read, but it highlights the sort of key points that you should demonstrate in your answers, particularly regarding how to be a good leader and what makes good leadership environment. The presentation is scored on its content, your presentation skills, and questioning. And again, each panelist will mark each domain out to 6, combining to 12 points each domain and a total of 36 points for the presentation. The second half of the management station will be based on a scenario and follow-up questions. This is typically a non-clinical problem-solving exercise. Some examples might be dealing with a difficult colleague, dealing with a patient complaint, dealing with a mistake or a challenge within the health system, for example, when there are no beds, or an ethical issue such as consent or Jehovah's Witness requiring a transfusion. The key to answering these questions is to have a good structure, and the SPIES framework is a good option for the interview, which stands for Seek Information, Patient Safety, Initiative, Escalate, and Support. So going through these one by one, firstly, you should gather more information about the problem at hand. So for example, if the patient is threatening to self-discharge, you want to investigate the reasons for this and assess if they have the capacity to do so. Next, you should consider whether this problem poses any patient safety issues. In this case, the main concern would obviously be discharge against medical advice, is that the patient might come to harm. You should then describe some initial steps that you can take in this situation. So for example, addressing any concerns the patient has, or if there's anything you can do to make them feel comfortable to stay. You should always escalate to a senior in these scenarios and inform them about the self-discharge and whether they want to speak to the patient themselves. And finally, you can offer support to both the patient and your team. Ultimately, if the patient has consent and decide to leave despite being informed of the risk, you might have to heavily safety net the patient. The follow-up questions from the management scenario may evolve around ethical principles such as defining consent, or management strategies such as how you might improve the service. So you might want to talk about how you can audit the processes and present the intervention at a clinical governance meeting. The scoring for the management section is scored on probity and professional integrity, and awareness of safety and ethics, judgment under pressure and prioritization again, and communication. And once again, each of these 3 criteria will score 6 marks from each panelist at the maximum. Finally, I want to end the video on a few general tips for the interview. So firstly, you should treat the interview like taking a driving test. So similar to how you need to exaggerate your movements to show that you're looking over the shoulder when you're switching lanes in the driving test, you need to sort of similarly state everything out loud in the interview, or it didn't happen. This is especially important for clinical scenarios. You could describe all steps of managing sepsis, but if you didn't actually say the word sepsis 6, it might cost you. Secondly, the most useful practice you can do for the interview is to say your answers out loud, as you will do in the interview. So when I was preparing, I would rehearse saying A to E out loud whenever I was in the car driving a short journey, so it became a mindless task I memorized really, really well. And whenever I get example questions, I would always get someone else to read the scenario to me and ask me the questions, and I will answer them as I would in the interview. It's really useful if you could find a buddy who is also preparing for the interviews and study together. And if you don't have an easily accessible partner, read in front of the mirror or read, with the camera on your computer turned on and observe your own body language. Thirdly, as we're moving to online interviews, you want to sort of spend the day before checking the positioning of your computer, the camera, and the background. Practice looking into your computer camera and saying your answers this way, and you can even record yourself to see how you come across to your interviewers. In the era of online interviews, I found this quite awkward at first because you aren't actually looking at the interviewer's face on your computer screen. But if you don't look directly into the camera, it's really easy to come across as disengaged because you are perceived as not making eye contact. So quite a difficult skill to master and worth spending some time making sure that you're doing it right. Finally, take advantage of the surgical colleagues who are close to you. Find some core trainees who have recently been through the process, as well as registrars and consultants who are more senior to give you a few practice runs. It's almost best here to find someone that you aren't overly familiar with to recreate the kind of pressure that you might feel in the actual interview as well. And that's it for the video. I hope you found this useful, and good luck to all of those who are going to be applying to CST soon. If you enjoy this content, please leave a thumbs up and subscribe for more videos in the future, and do leave a comment below if you have any questions at all and I'll try to answer them. That's it for now, and I'll see you next time.